Good afternoon, everyone. Thank you for joining today's webinar. I'm just going to go over a couple of housekeeping notes before we begin. In this platform, all attendees are muted, so while you won't be able to ask any questions through the audio, please note the Q&A section at the bottom of your screen. If you have any questions that are not addressed during the presentation, feel free to use this option, and the presenters can address at the end of the presentation. And today's webinar is being recorded and will be posted on our website. As a registrant of today's session, you will receive an email with a link to the live session. It is my pleasure to introduce our two presenters today, Dr. Sean McNeely, the Medical Director for University Hospitals Urgent Care, and Dr. Benjamin Boswell, the Medical Director for University Hospitals Orthopedic Injury Clinic. Now we'll turn it over to Dr. McNeely.
Thank you, Kaylee. Appreciate the introduction. Welcome, everyone. Good afternoon. I guess it's good evening. Thanks for joining us. There we go. Couldn't get the slide to advance. So just for a little bit of information and background, you have choices when it comes to getting your care. So when you look at these different choices, this is a kind of a fever type monitor type as going from being well on the left-hand side to being extremely emergent on the right-hand side. And we have different locations. We have primary care and convenient care. We have our virtual visit, which is our online ability to see people. We have our urgent cares and our orthopedic injury clinics, which we'll be discussing today, as well as our emergency rooms. Obviously on the far end, if it's really bad, that's where you need to be. If it's minor and you can wait to follow up with your primary care doctor or even just see a virtual visit, those are locations that are available to you. So what's an urgent care? I'm not going to read the screen specifically, but what is an urgent care? It's kind of listed there. Most of us probably have been to an urgent care. An urgent care is a facility that's open, takes walk-in patients, sees everything from colds to ankle sprains to sore throats to lacerations and what have you. At our urgent cares, you'll see board certified providers, both physicians and advanced practice providers as nurse practitioners and physician assistants. We see adults and children. I've seen people as little as just a few days old, and I think at the oldest I've seen is 108, 109. So not many of those on both of those ends, but a lot of people in the middle. Most of our patients are in the range of probably 3 to 55, but many people do come see us. As I said, there's no appointment necessary. You are able to get it in line at home. We have a product called Solve. You can get it off the UH website or go to Solve and get yourself in line at home so you can wait there. Keeps your waiting low. We try to make your appointments quick and fast, and we get you taken care of. And then if you need to get to somewhere else with a referral, or if you need follow-up, we have to decide that. We treat illnesses and minor injuries. There is a cost savings when compared to an ER visit. We're pretty much about the same cost as your primary care provider. Copays vary, something you need to look at with your particular insurance company. We do have x-rays available on site all the hours that we're open, and we do some lab tests. So what are some of the common things that come to see us? Like I said, colds, things like sinus infections, sore and strep throats, back pain or strains, bladder and kidney infections, such as what people call a UTI, earaches, swimmer's ear, minor irritations and infections of the eyes. We see stomach ailments like food poisoning, diarrhea when you're vomiting. Like I said, minor injuries and accidents, sprains, strains, bumps and bruises, cuts and lacerations as long as they're minor. We don't see things where something's sticking out bone-wise or when there's severe damage. We can stabilize you if you walk in, but those are probably locations or things that you need to be at the appropriate location, which is an emergency room. We do see possible fractures and skin and nail problems like poison ivy or this time of year, a little bit of sunburn. So that's kind of an urgent care. Dr. Boswell?
Yeah, so hi, Dr. Boswell. Nice to meet everyone. So I wanted to come on here and talk about what the Orthopedic Injury Clinic is. So the Orthopedic Injury Clinic is essentially, can we go back? There we go. An Orthopedic Injury Clinic is very similar to an urgent care, except that we specialize in orthopedic injuries or musculoskeletal injuries. Okay, so we do take care of children and adults. We take care of, in the single digit age anywhere up, and I've had a couple patients over there, over 100 years old as well. Like I said, we specialize in orthopedic care. We have access to diagnostic imaging. We have X-ray on site. We have the ability to check further advanced imaging rather quickly if we needed to do so. The individuals that staff the orthopedic injury clinic are going to be orthopedic providers, both board certified physicians and advanced practice practitioners such as nurse physician's assistants and advanced nurse providers. It's ideal for injuries such as broken bones, sprains, and strains. Okay. Again, as we discussed before with the regular urgent care, there are walk-in appointments. We do have the ability to schedule appointments. If you would like to be scheduled the next day, we do 24-hour appointments ahead of time. So you can call in and make an appointment ahead of time, 24 hours. But we do take walk-ins as well. So we do both. You'll see that here it says next day surgery is if necessary. If we see that you have an injury that likely needs surgery that can be done as an outpatient, we will either the provider that's seeing you in clinic that day will either be the one to take care of you, or we will have a specialist involved right away. So we have specialists in every area of orthopedics that are on call for the injury clinic every day. So, for instance, if someone comes in with an ankle fracture that we feel that needs surgery, we will get that individual involved right away. And if we determine that you need to have surgery, they will begin to schedule it the next day if possible. So as soon as possible. As discussed before, there are significant cost savings compared to the emergency department. The emergency department is very expensive, and there is a significant cost reduction. But again, depends on your insurance. Okay. Like I said, we do have X-rays in-house. We'd have the ability to order MRIs or CAT scans very quickly if we need to. We also have ability for splinting. We have all kinds of braces available. We have cast techs there that can do casting for you as well. And then even in some situations, if we feel that an injection would be helpful, we can do that day as well. Okay. Next slide, please. So again, we provide care at lower cost than the emergency department. Okay. And, when we compare regular orthopedic injury to urgent care, again, it's very similar, except we specialize in orthopedic injuries. Again, like we discussed, there are orthopedic specialists in every area of orthopedics. And then again, we have multiple different devices. We have boots, we have slings, we have wrist splints, we have thumb and wrist splints, we have elbow braces, we have kind of everything that you would see in an orthopedic practice available for us to use. Next slide, please. Okay, so then the big question becomes, well, when do you go to the injury clinic? So, if you have an accident, a minor accident, if you have a sports injury, if you're out running and twist your ankle or hurt your knee, it's kind of the place to go, okay, because we do have orthopedic providers available. Specific injuries, broken bones, sprained wrists and ankles, even if you have a small displaced fracture, we can most often take care of that in the injury clinic. So if we have to do a small reduction, we can do that in the injury clinic. Certainly if it's a large fracture that would need further care, we would likely send you to the emergency department. We can take care of dislocations, sprains and strains, joint pain, tendon pain. We often see upper back injuries, low back injuries, neck pain, sports related injuries, any knee, like I said, knee injuries, muscle injuries, tendon ligament injuries. We have a very wide capability to take care of all these injuries. Next slide. So this is the tough question. So when do you go to the emergency room? So this, just remember that emergency medicine providers are specialized to save lives. Okay, so if you have something, or if you're concerned that it may be life-threatening, you really should pick up the phone and call 911 and go to the emergency department. But that's not always easy to tell, right? So if you're not certain, and if you come to an urgent care or the orthopedic injury clinic and we evaluate you and we determine that it's something that you would need advanced care or this could be life-threatening, we will arrange your transport. We'll notify the emergency department. We will make that happen. So if you come to the urgent care or the injury clinic and it's something that's higher level, don't worry, we will take care of it as well. We won't be able to take care of it in that office, but we will get you to the emergency department as soon as possible. So, you know, we're all available, and we can all get the process going and get you where you need to be.
And ideally, it's best to get to the right place first, but we'll do our best to take care of you if you arrive at the urgent care. We're trained to do that as much as the orthopedic injury clinics are as well. So Kaylee, do we have any questions or some scenarios where people want to know where they should go during different injuries or different situations?
One of the questions that came in is, how can I tell if my ankle is sprained rather than something more or less serious?
I can take that if you'd like,
Sure.
Dr. McNeely. So yeah, it's a hard question. It's a tough question to answer, and we don't always know. Okay, but for sure is, you know, let's say hypothetically, if you were not certain if you broke your ankle or if you sprained your ankle, if you were to come to an urgent care or the injury clinic, we will be able to get x-rays. We'll be able to tell, we'll do an evaluation. We'll be able to tell pretty quickly whether it is something minor or if it is something that needs more care. In the injury clinic, even if you have a broken ankle, oftentimes we can put you in a boot or we can put you in a cast. And like I discussed earlier, if we do imaging, we do evaluation, we determine that it's something more serious, we will either get the specialist involved right away so we can get you to the care as soon as possible, or if it's something that's even serious enough to go to the emergency department, we'll arrange that for you. Okay. But yes, it's a good question, but not always an easy answer.
Agree. That's the same thing that we see, and truly that's sometimes what we have us for, is you come in, we help you decide if it's something worse. Other questions, Kelly?
With people returning to work and to sports, what safety measures are in place to help keep patients safe?
Are you asking patients safe at our locations, or are you asking at when they're returning to sports at the sports venues or playing the sports themselves?
When they're coming in for care at one of your facilities.
Would you like us to meet? I'll go ahead and go first then. So the urgent cares are run, we have a couple different levels of urgent cares currently. One of the things we've added is something called a fever clinic. A fever clinic is where we're sending our patients who are sick and they have a transmittable disease. Still, all the urgent cares do see sick and well, but we do make sure that we have people schedule and solve so that they're not bumping into each other in the waiting rooms. The waiting room chairs are 6 foot or more apart, and we try to keep people not waiting in the waiting room at all. We clean our waiting rooms multiple times a day with appropriate cleaners. The staff are all wearing masks, and we ask all our patients who come in to wear masks. We take temperatures at all UH locations and we ask everyone to wear a mask at all UH locations. But we take temperatures at the door. We ask several questions about risk, and if the patient fails that risk screening, we make sure we get them back to a room quickly. Some locations, if they're not treating ill patients, like our occupational medicine locations, they send them to a person who can treat that fever or that other illness. In the back, our staff are wearing masks and appropriate personal protective equipment that keeps them from getting it so that they don't transmit it to you. We regularly clean our rooms. We've taken much of the stuff that was in our rooms out so that it can't be touched and that we don't have to clean it, but we then clean the rooms aggressively after each patient. We also, as providers and staff, get our temperatures taken at least a couple times a day. We answer the same questions. We do the same cleaning, and at the end of the day, UH does an aggressive cleaning of all our locations to make sure that everyone is well. Dr. Boswell, did you want to add anything to?
Yeah, I did want to add one more thing, and excellent explanation. We do exactly the same thing in our facilities. if you are screened, like Dr. McNeely said, if you are screened positive, you are sent to a provider that can handle that. Also, though, if during your screening process, if we feel that you are very ill, we will again arrange transportation if you go to the emergency department where you can be cared for at a higher level.
Okay, Kaylee, what other questions do you have for us tonight?
What are some of the common injuries you are seeing within your facilities right now?
I can take this one if you'd like, Dr. McNeely.
Absolutely.
So yeah, great question. So what I've recently kind of as we're starting to enter the spring season, well, I guess summer now, as hot as it's gotten, and as things are starting to open up, we're seeing a lot of kind of injuries with activities of daily living. Seen a lot of knee pain from gardening, sprained ankles from walking. I've seen a couple ankle injuries from running, foot injuries, and actually I've seen quite a few of overuse injuries too. Things like shin splints and heel pain from people being out trying to be active as much as they can. And this is kind of the season we start seeing that stuff. As sports are going to start getting back with everything, we're going to see a lot more sports specific injuries, but for now it's just kind of a lot of the general ankle pain, knee pain, hip pain, stuff like that from being out and being active.
We're seeing some of the same stuff, but in urgent care versus an orthopedic clinic, we tend to see the first injury, first part of it. We see them the first time, and then we're going to refer them on potentially to the orthopedic injury clinics or an orthopedic provider. So we're seeing some of the same stuff: bumps, scrapes, bruises, falls, lacerations. What else is everyone out there asking, Kaylee?
If I have had injury that's been a while and I'm having some chronic pain, do I visit one of these facilities? Should I see my primary care doctor? At what point do where should I go for treatment if I have a chronic pain of the knee or back?
So I'll take that one if you don't mind, Dr. McNeely, or at least from my end. So, you know, we do call it the Orthopedic Injury Clinic, which would suggest that we are there only for acute injuries, but that's not the case at all. We will see any kind of orthopedic pain. So, you know, ideally you would want to see your primary care provider. But if you can't, or if you're delayed, or if you want to come see us in the orthopedic department, you can very easily come to the injury clinic. We take care of injuries that happen the day of coming into the injury clinic, but I've also seen patients who've had pain for several years coming to the injury clinic, and we treat everybody just the same. So it's completely fine to come see us in the injury clinic for that.
So if the urgent care answer is, while we do see patients with multiple types of injuries that have been going on for a while, our breadth of care, scope of care is a lot smaller. And so if you're having pain and discomfort for a long period of time, and it hasn't gotten worse suddenly, or you haven't had a new injury, we're probably going to be referring you to the injury clinic anyway. So it's probably a better place to start there. If you just fell again and re-injured your knee or re-injured your back, then obviously we're a great place to start. But once again, we're the place to start in many of these circumstances, and not the place to get your comprehensive care. We're a place where an orthopedic injury clinic is going to give you what you need. Obviously, if pain is an issue, they may also be referring you to somewhere else to help with that as well. Pain is a complex situation, and kind of, it isn't just treated with a few things. There's a whole realm of different occupations that do treat pain. But if it's Saturday night and you're stuck and you can't figure out why things aren't going your way, I guess it's not Saturday night. I guess we're only open 9 to 5 on Saturday and Sunday. But if it's in the middle of the weekend, we're happy to help you get to the right place. But once again, if this is something that's been going on and hasn't gotten worse, but you're just tired of it, it's probably best, like you said, start with your family physician or your primary care provider. And if they can't handle, move over to someone who can complete your care, which is the orthopedic department more than us. So what other questions do we have out there, Kaylee?
Where are the injury clinics located?
So I think we do have a map, correct? I think we have them here.
There we go.
Yeah, there
Perfect timing. That's the next one.
you go. Excellent time for that
So as
question.
you can see, the emergency rooms are in red, the urgent care locations in, I guess that's orange, and the orthopedic injury clinics in blue.
And so as you can see, we have numerous locations in numerous places. I wouldn't know the addresses off the top of my head, but our good friend Google is a very easy way to find those locations as well.
The University Hospital's website has some great information and can get you to Google, can get you directions, and get you to different places. So Kaylee and her team has done a great job making sure that you're able to get these addresses and locations. And usually when you look for care on the site, it looks at your address if you allow it, and as to where you're at and get you the closest location. So it's really convenient. Urgent Care's the Solve app also allows you to get to us.
So we have another question that came in. If I were to fall directly on my shoulder and in acute pain, how would I be evaluated at the orthopedic injury clinic?
Yes, it's a good question. So, again, you could call, make an appointment, or especially in this situation, you would walk in, and we would have whoever's working the injury clinic that day. Like for instance, if it was me, I would see you as soon as possible. I would get X-rays of your shoulder. Well, first I would evaluate you and determine if you need X-rays. We have ability to get X-rays if we need them, and then we can decide at that point, how bad we think the injury is, if we need to get further imaging, such as a CAT scan or an MRI, and we will be able to make those decisions that day.
What other questions do we have out there, Kaylee?
Those are the only questions so far. If anyone has any more questions they'd like to ask, now would be a good time. Feel free to use that Q&A function to submit those questions and or scenarios.
So I'll say a few more things about urgent care while we're waiting on questions, I guess. Urgent care is kind of like a safety net to some extent. We're open Monday through Friday, 9 to 9, Saturdays and Sundays, 9 to 5, and holidays, 9 to 3. We're only closed on Christmas Day, New Year's Day, and Thanksgiving. We're here for you. If you don't know where to go, we're here to help you to get where you need to be. Sometimes, we've had patients who come in and say, I've had a rash for 6 months and I've been to 3 dermatologists and they still don't have the answer. We may not be able to get you the answer, but we have the whole breadth of university hospitals behind us, and we can get you to someone who will help take care of you. We do something called Schedule Me Now, which is our ability to put patients into another provider, even get them to the orthopedic injury clinic. So we're kind of that place for you if you can't get into your primary care doctor, they're out of town, the appointment's too long, you got to pick your kids up from school. I guess you're not doing that right now, but and you can't come in at a certain time, we're able to see you during all those hours. So that is our availability, and we're here for you. Like I said, we can't treat everything, but we will help you get to where you need to go if at all possible.
All right, so we have a few more questions coming in. What are the hours of the orthopedic injury clinic? I know, Dr. McNeely, you covered urgent care.
Yeah, thank you for that question, because it quickly reminded me that I didn't discuss that earlier in the slide. So we are open Monday through Friday. We have appointments from 8:30 to 4 o'clock. We are working on expanding that as our volumes increase. We are planning to be open later at nighttime and on the weekends. But for now, we're open from 8:30 to 4. And again, you can walk in at any time. So if you injure yourself, let's say a Monday night, you can come in first thing Tuesday morning. We'll see you right away.
Thank you. The next question is, recently had a knee replacement and then a revision. I received several comments about the horrible scar and have tried several creams. Any suggestion on how to treat the scarring?
I'm sorry, you broke up. Any treatment, how to treat the scarring?
The scarring.
Oh, that's That's a tough question. You know, first of all, I would suggest following up with the individual that you saw before, but you could always try to discuss it with a dermatologist or a plastic surgeon. That's not something we would be able to take care of in the injury clinic, unfortunately. But that's what I would suggest.
Definitely not a normal urgent care type question, but you know, whenever a person gets a laceration or has a someone place a incision on them, healing is independent or dependent on many things, including your ability to heal and the way you heal and how things were done. So sometimes that's a really tough question. So, but I agree totally that a dermatologist or a plastic surgeon are your best people to talk to about how to deal with that and what might happen. But understand that some things are beyond the scope of capacity at this point in our history of medicine. Other questions, Caleb?
Does either entity or service cover workplace injuries?
So urgent care definitely covers all workplace injuries. We take all BWC first injuries. We don't usually follow them up. Although if you get a laceration, we repair it and we take the stitches out in a week, we do follow you up. We then refer you on. If we see you and you need further care, we refer you on to someone else. We work with you and your company to make sure you get back to work as quickly as possible. And it's something that's definitely something we regularly do. Dr. Boswell?
Yeah, so great question. As far as the injury clinic, we do take care of workers' comp injuries. You, depending on who you see that day, you may be continue to be evaluated by that provider you saw. Then they would see you as their regular patient. If not, they would put you or have you scheduled with the person that would be your provider, more or less in charge of the injury. But yes, we do see work-related injuries, and we'll get you to the right person.
Perfect.
The other location to think about is University Hospitals also has occupational medicine. I'm also the medical director for occupational medicine. And so they do see same day injuries and follow up of workplace injuries and work with all insurance companies and the BWC.
Dr. McNeely, I know you covered this briefly. You talked about using Solve to book an appointment for urgent care. Urgent care is a walk-in service. Do you want to explain a little bit more on what Solve is and the benefit of using that platform?
So urgent care is very convenient because you can just walk in and get seen. It's inconvenient in the sense that anyone could walk in and get seen because we don't control the number of people walking the door. So most mornings when the door opens, there's a pile of people waiting at the doorway. Maybe not so much in the last few months as things have changed in the world, but we're still seeing a bunch of patients that come in quickly. Solve is a way to get yourself in line so that you don't have to wait. I mean, there's always a limited number of providers, a limited number of people we can see per hour. So if we can spread the patients out while still giving them the opportunity to get in and get seen, that's a perfect way to do that. So online, you can go to the UH website, you can go to Solve, you can use an app off your phone, and you go to Solve and you get yourself in line. It's just like call ahead seating at a restaurant. You're not first in line the minute you call ahead, but you're put in line, and when you arrive, they tell you about how long to arrive. They give you a text to remind you about arrival. And then when you arrive, you're in that position in line. The sister patient or your second patient, and we'll kind of update you each time. It's great to use if you have a cell phone that it does those type of apps, a smartphone, because it will update you regularly as to where you are. It'll tell you if there was some type of emergency and we had to delay your care. That's not very frequent, but that's the way it works. The other thing is it helps us to know how long you've been waiting so we can make sure we get you through quickly. And finally, when you're done, it'll send you a text message saying, hey, how was your visit at the urgent care? We like to hear, I'm sure as the orthopedic injury clinics do as well, how we did, so that we can do a better job for everyone that comes through, because we're always trying to improve. And that's a great way to be able to have a voice about your care.
Okay, so we have another question has come in. If I receive care at the injury clinic, will a follow-up appointment be with the same provider? And I also am posing that same question for you, Dr. McNeely, from an urgent care standpoint as well.
So in regards to the injury clinic, it really depends. It depends on a couple things. It depends on what the injury is. It depends on what level of care is needed. And it depends on who's working in the injury clinic that day. So we have multiple providers that work in the injury clinic. For instance, when I work in the injury clinic, I do sports medicine. So I do pretty much a little bit of everything. So if it's a minor non-operative injury, then I will have you follow up with me. If I feel that you need surgery or you need high level of care, I will have you follow up with that specialist. Like I said earlier, if I think that it needs something like surgery for an ankle fracture or something of that sort, then I'll have you follow up with the ankle specialist sooner than later from the injury clinic side.
So from the perspective of urgent care is really an alternative to some of the things that you might do normally in your regular care. So you're going to see somebody and then they're going to send you somewhere else. We're not really a continuous care place. It's not the place. We're going to help you get to the next person. Occasionally, you'll need your stitches out. You'll need something done that we do follow up people with. Usually our providers have a home location. So if they work at Westlake, most of the time they're at Westlake. If they work at Sugar and Highlands or Minoff Urgent Care, they're there. But remember that we're open 76 plus hours a week. And so that's two people's jobs at least. And so you're going to have at least a couple providers who are there. Plus we don't close except for those 3 holidays. So we do, when people are on vacation, have different people. So all of us are trained the same way. All of us have board certified, and all of us are comfortable with caring for people that we only see once and moving them on to the next person. So the answer is probably not really, or not often, but we're here for you.
Great. Those are the only questions so far. I don't know if anybody else has anything they'd like to ask before we wrap up today's webinar. If so, feel free to submit.
I think the most important thing to remember is that university hospitals, unlike some smaller locations, is a large organization that has multiple layers. We have everything from your virtual visit all the way to your emergency room. We have everything from a location that has just a small urgent care, a small primary care office, all the way down to the Cleveland Medical Center, which is what they're calling now a quaternary hospital, which is a big hospital that does many things. We are greatly supported by our team. I've never felt like there wasn't something we couldn't call somebody and get a hold of them to help us out. So in the end, if you come see us, we'll get you taken care of. And that's the key. The decision is to come in. With COVID and all that's happened, we haven't talked much about that other than just our cleaning and what have you. There have been people who've put off their care. Their knee still hurts too bad and they really need it replaced, or their hip needs replacement and they aren't getting it done. For a while we couldn't do that, now we can. There are people who put off immunizations. There are people who don't get their laceration sewn. There are people who have other symptoms and they're not getting cared for. It is really important that you get your care. COVID's there, but we are working hard to make sure that we prevent any spread of that. And there are things that are just as dangerous or more. Please come get your care and we're happy to see you. Dr. Boswell, any thoughts on that? Have you seen some people that delayed care and got worse or what have you?
Yeah, absolutely. So very common both in the injury clinic and in the emergency department. It's very unfortunate with the environment of the COVID pandemic. But Dr. McNeely said it perfectly, is we're all here, we're all available, and it's our job to take care of you. And it's, and as soon if you have something that's bothering you, or if you need to have your regular checkup, it's really important to come in so we can get that done for you. So, but yes, unfortunately, we're seeing a lot of that. and I think we're going to see more and more as time goes on, as we continue to open up. But yes, it's so important to get back in touch and try to get taken care of as best you can. And we're there for you.
Okay, Kaylee, any other questions for us tonight?
Yeah, so if I am experiencing a minor injury, where would be my first place to receive care? Should I start with a primary care physician? And what happens if I don't have a primary care physician? Where should I go for treatment?
Yeah, so certainly if, like we've talked about before, ideally you'd like to see your primary care physician if you can. If you don't have a primary care physician, going to the urgent care is a good option, or come to injury clinic. They're all really good options, because whatever injury you have or whatever nagging pain you have, we will get you to the right place.
I agree. I don't really have anything to add to that other than just come on in. We'd love to see you. We'd love to take care of you. We enjoy doing this. That's why we're doing it. That's why we came on this evening to talk with you, because we'd like to get you here and help you out. Kaylee, any other questions?
No, not at this time. I think we can go ahead and wrap up today's webinar. If you just want to advance the slide a few to, there you go. So I just want to thank you both for presenting, and also to our attendees today. A lot of good questions, a lot of great information. Just a couple reminders. We'll email you a link with the recorded session, and it'll also be posted on our website. And if you want to learn more on where to go for care, we have the website uhhospitals.org/choices that shows all of our options, from the virtual visit all the way up to emergency care, and where the best option would be based on your need. And that concludes today's session. So I just want to thank you all for attending, and have a great night.